This is Dr. William Schaffner. I'm at the Vanderbilt University Medical Center in Nashville, Tennessee, and I'm an infectious diseases specialist who has a special interest in public health. So primary care physicians have a difficult time when it comes to vaccinating adults. They can keep some vaccines in the office, but others are left in the pharmacy and you have to go there to get them. And what's the story on that? And that's because with adults, anyone older than 19 years of age, we do not yet have in the United States a coordinated public and private national immunization program for adults. Now, many of us have medical insurance, and many of those medical insurances cover vaccines, influenza vaccine, for example. But some of us have deductibles or co-pays that act as financial barriers. And then when you look on the public side, Medicaid should theoretically cover everyone eligible, but that's a state-by-state problem, and some states really don't pay sufficiently the doctor for either the vaccine or for an administration fee. So doctors have a hard time there. And lastly, even Medicare, although it will pay first dollar coverage, and this is a good thing, obviously, for influenza vaccine and pneumococcal vaccine, unfortunately, when it comes to the shingles vaccine and it comes to the vaccine against whooping cough and tetanus, that's in Part D of Medicare, and that provides doctors' offices a great deal of difficulty in managing. So the doctors here at Vanderbilt, for example, will write a prescription for those vaccines to their patients. The patients take the prescriptions to our pharmacy, and it's in the pharmacy that they get vaccinated. We really need in this country a comprehensive program for adult vaccination to remove those barriers, and so we can extend the benefit of vaccines and prevent many of those diseases to our entire adult population. We've done a very good job, a wonderful job in vaccinating children. Let's move it on up to those adults also, and let's get our adults covered and give them the benefit of the best 21st century prevention. For primary care physicians, the Affordable Care Act will offer a genuine advance because they will oblige all insurance providers, eventually, it's a timeline, but they will oblige all insurance providers to provide first dollar coverage for all vaccines as recommended by the CDC's Advisory Committee on Immunization Practices for Adults. So the financial barrier will diminish, be eliminated really, and doctors will be able to learn about these vaccines and be aggressive in promoting them to their patients because they'll be able to have them right in their offices. Now, the ACA, the Affordable Care Act, is not a complete solution to the problem. One of the things that was in the provisions but was taken out at the 11th hour was that all of the vaccinations that people who are age 65 and older should get should be in what we call Part B of Medicare. That's the part where you get first dollar coverage. Unfortunately, that piece of the legislation didn't make it, and so Medicare continues to be Part A, will cover pneumococcal vaccine and influenza vaccine, but the other vaccines are in Part D of Medicare, which is the pharmacy's prescription drug benefit. That will still make it difficult for us to provide vaccination as comprehensively as we would like to senior citizens. We need to fix that. The Affordable Care Act, and those of us in infectious disease hope that it doesn't get repealed, will extend the benefits of vaccination and preventive health services to many people who are now not covered, and will provide the vaccine as well as a reasonable administration fee for physicians and other healthcare providers. Once that's well in place, and it's coming online as we speak, then we can begin to promote vaccination both to the general public as well as to physicians who care for adults. Medicaid is, of course, a cost-sharing relationship between the federal government and the individual states. and each state can design its own Medicaid program about what it will cover. And when it comes to vaccines, we have 50 states, and they vary just about 50 different ways. Some states, such as New York, pay very well for a doctor to immunize people, adults, who are eligible for Medicaid. Other states have not put the same value on prevention and vaccines. And so doctors who wish to vaccinate patients in those states actually may lose money. So you can imagine they're not going to be very aggressive in vaccinating. So that's also a national program that we ought to be able to solve and fix so that our entire adult population can get the benefit of prevention that vaccines can provide. Well, even when the ACA is fully enacted, there will be adult populations who are not covered. Those of us in public health and infectious diseases would love to get those people covered. And there will still be problems with patients who receive their care through Medicare, because all of those Medicare benefits will still be divided into Part B and Part D. The Part D part will still oblige physicians who wish to have their patients vaccinated against shingles and against whooping cough to take prescriptions to the pharmacy and get vaccinated in the pharmacy. Mind you, I'm all in favor, strongly supportive of pharmacists being more active in immunization, but I would like physicians to be able to vaccinate in their offices also. And I think pharmacists have a wonderful opportunity to provide more immunization services to patients across the country. We're all familiar with the fact that there are now signs outside of many pharmacies that offer influenza vaccine, pneumococcal vaccine, and shingles vaccine. And we welcome pharmacists as providers of vaccines for adults. After all, we've got about 300 million adults in the United States each year. We physicians could use a lot of help and we welcome the pharmacists in giving it, in getting everyone optimally vaccinated. It's not quite clear, Steve, whether even with ACA, whether doctors' offices are going to provide shingles vaccine. Part of what we need to do is actually educate doctors more about these vaccines, their availability, and the appropriate patients who should be vaccinated.